Welcome back to my channel, Adventures with the Haydens. Today I just wanted to talk about a subject that's kind of been on my mind lately. I work for a hospital here in the Denver area, and I also help teach new grad nurses IV skills. Now, IVs, if you don't know, are intravenous small plastic catheters that sit inside your vein. They are inserted into the vein via a needle. There are several different types of needles that range from 22 gauge to 14 gauge. Now, 22 is the smallest needle. It is also the thinnest. 14 gauge is, you could compare a 14 gauge needle to a harpoon going into your vein, essentially. I don't think I've ever seen a 14 gauge put in, or even attempted to be put into somebody ever in my career. So the most common ways for IVs, the most common gauge of IV to use are generally 18, 20, and 22. 18 gauge IVs are considered a large bore IV. The IV themselves can pass 96 milliliters of fluid through them per minute. Now, that is a lot of fluid per minute, and that all has to depend on the tubing that you use, if it's a 15 drop per milliliter tubing or a 60 drop per milliliter tubing. So what that means is, for every 15 drops of fluid into the chamber, you receive 1 milliliter of fluid, versus the 60 drop set is for every 60 drops of fluid into the drip chamber, you receive 1 milliliter of fluid. So having it wide open, the drip chamber, and then plus an 18 gauge catheter of 96 milliliters of fluid per minute, you can put a 500 ml bag of fluid into somebody very quickly, within a good, you're talking 96 milliliters a minute. That's a good 6 minutes for that 500 bag. 5 minutes if you're truly wide open and have a good vein. Now, I came on today to say that new grad nurses and IV skills. New grad nurses, you were taught in your IV class in school that how to do IVs on mannequin arms. That is absolutely fantastic. It's a great way to teach, but it does not prepare you for the outside. It does not prepare you to put IVs into actual patients. And it is not an easy task. Being a critical care tech, I do upwards of 12 to 15 per day, 4 days a week. I compare it to trying to fit a straw into another straw. And then on top of it, you have veins that can move, that can roll, some more than others. Your patients feel everything you're doing because you are putting a needle under their skin. Those pain receptors are going off. It does not feel great. It is just it can be a very difficult task at times. And I wanted to come in here and say that don't be discouraged. If you're a new grad nurse, if you're a new grad EMT, paramedic, tech, you work in the hospital, and you're having trouble with your IVs, do not give up. Don't give up, because the more you actually practice, the more you actually attempt to put IVs into your patients, the better you're going to get, the better understanding you're going to have of those IVs and of different veins, of where you put them. And along those lines are, the easiest vein in your arm would be the AC vein, which is generally right up here. It can be either off to the running on the side of your arm here, right dead in the middle. This is going to be the quickest and easiest way for IV access. Not some patients you can't find them. Some patients they are prominent. Other times you'll have more of a difficult stick. And that's okay. New grad nurses and techs and anybody out there who puts IVs into patients needs to understand that you will not be a superhero of IVs. You will not go in and get a 100 out of 100 for IVs. You just won't. There will be some days that you will, and there'll be other days where you're asking yourself, what on earth is going on here? Why can't I hit the broadside of a barn even if I'm trying here? And you just feel horrible. That's okay. If you don't feel horrible, you're not human. And being human in healthcare, you have to relate to your patients. And when they're saying, ouch, this hurts, it does. When I got my IV authorization here in Colorado back in 2012, we had to stick each other in class. And having an 18 gauge IV drug through your top of your skin layer to try to find a vein gives them pretty doggone good perspective of when your patients tell you, ouch, that really hurts, why are you digging in my arm? Well, you should have some background on that, and I certainly do. I know some nurse programs do not let you stick each other in class, and that's perfectly okay. You just have to understand that you're going to have to try your best to develop that empathy that you have, that you can develop for your patients. So when you are having a hard time, you are certainly giving it your all. You're not purposely not missing a vein or something like that. And that's the point. If you are not confident walking into your patient's room and you're going to stick them with an IV, your patient will find out immediately. If you're fumbling around with equipment, if you're unsure of where to go, you're just having a hard time looking around for the vein, then your patient's going to figure it out pretty quick that you're inexperienced or you have not done this very often. But that's okay. The more you do, the more you build confidence. Now, I have taken a good 5-6 minutes looking on patients for a good vein to use. And generally, sometimes veins are hard to find, depending on your patient status. If your patient has done a colon prep for a colonoscopy, they drink a lot of liquid, but it all comes out in the bowel prep. They're, at that point, slightly dehydrated. They haven't eaten anything in the last 8 to 12 hours. They've now just done a bowel prep to clean their colon out for a colonoscopy. Sometimes people's veins hide, and that's okay. There's two types of people who do well with IVs. Sometimes people are feelers, they can feel the veins. Others have to see the veins. If you can fall somewhere in the middle to where you can feel their veins and see them, fantastic. If you're feeling and you know it's a good bouncy, has that nice, bounce to it, and you're feeling it, tapping it, and then you got it and you can hold some good traction, go for it. If you're just not confident and you're like, I think there's one there, well, look elsewhere. Look up and down somebody's arm. Look in their hands. I have a great vein that runs right through here. I have several right through here that I can find on myself. I don't know if you guys can see that. There's one right here. And there's also one on running up this side as well. And I just know that from looking at myself. I know, and that's a great place to start. Look at your own veins on your own arms and see if you would be confident going for that vein if you were the patient that you were trying to start an IV on. Now, obviously, you can't do it on yourself, or you can certainly try, but I would not recommend that. But starting IVs can be a difficult task. Keep at it. Keep practicing. Remember, there's 3 good tips. Hold traction. That is your first key. When you found a vein, hold traction. Make sure that vein's not going to roll away on you. It may shift left or right with needle pressure on the skin. That's okay. But if it's going to track across half of somebody's hand and you're just going to go after it, yeah, that's going to cause some pain to your patient. Second tip, always hold the IV in a way that is comfortable for you. And then I always say, don't try to start an IV over your thumb. Don't try to do this with a IV needle, because your angle's gonna be way too steep if you're sitting there like this. Your angle should be pretty, almost not flat with the skin, but fairly 15 degrees at most. And then your last tip, your third tip, is gonna be get in a comfortable position. I'll say it again, a comfortable position. I don't care what position that is. You could stand, you can sit, you can kneel. I personally kneel for all my IV starts because I am comfortable there. Now, standing, sitting brings to the fourth point here. The bed has an up and down. It generally has an up and down lever, either a foot pump lever, an electric one, whatever the bed has. Raise it if you need. If you're standing to start an IV, don't hunch all the way over and bend down and hunch your back to start an IV. That's just uncomfortable, unrealistic, and if you got 30 years of nursing to go, you're gonna wreck your back. Bring the bed level up to you. Throw the side rail up on the opposite side that you're working on, so your patient doesn't roll out of bed. Pump the bed up to you, up to a good level. If you're sitting, and your best way is to raise the bed a little. Don't just hunch over sitting. Just like standing, don't hunch over sitting. If you're and the fifth tip here is use gravity to your advantage. Have your patient put their arm over the side of the bed and just say, hey, hang your arm over the side of the bed for a couple minutes and leave it there. Don't rest it back up by your side. Gravity is going to help pull that blood down and engorge your veins. Your sixth tip is, and use this together, wrap somebody's arm with a heated blanket. A heated blanket helps dilate veins. They vasodilate, so they get bigger. You know, wrapping somebody's arm up in a heated blanket and then having them hang their arm off the side of the bed is going to help tremendously. I've had patients where I have not found a single vein on their arm. I can't locate their AC at all, and I just throw a heated blanket on them, say, hey, can you keep your arm here for about 3 or 4 minutes, just like this? And I'll come back in 3 or 4 minutes. And during that time, my nurse is generally asking them medical history questions, and, you know, they just forget their arms hanging off the side of the bed. I'll come back, and I have my choice of veins. Sometimes that veins will pop up that I didn't even think were gonna be there. And I will say this, I will give you this preface: do not hot pack your patients. Do not put a towel with burning hot water on your patient's arm. You will cause them a first or second degree burn. It has happened before. My hospital, it's against policy to do that. You know, I wrap people up, and that's all I can do. So again, as a new grad nurse, new grad tech, whatever you're putting in IVs for patients, you know, hold traction, use gravity towards your advantage, wrap your patient's arm up, always look for your best spot for your vein. Don't try to start an IV over a finger, and keep practicing. Always practice. Don't give up. Comment down below on your experience starting IVs. What has been your best experiences? What has been some of your worst experience with that? Comment your tips and tricks that you've learned over the time, or you've seen somebody do, or anything like that. Just keep practicing. Take some IV tubing and practice on IV tubing. That works fantastically. So I just wanted to jump on it here, give you guys some tips, tricks, things I've learned over the past, and comment down below. Like, subscribe, and I see you guys the next time around.